Single leg press using rubberized resistance. Stand facing the pool wall. Place the foot on the center point of the rubberized resistance and pull the foot back as you extend at the hip and at the knee joint, pressing the heel on a diagonal down towards the pool bottom, ending slightly behind the body. Keep the spine, knee, and ankle aligned during all phases of the movement. The rubberized equipment allows for concentric-eccentric muscle work for the gluteus maximus and hamstrings. This exercise is recommended for low back pain in phase 2 of programming. Be careful to avoid hip flexion past 90 degrees and hyperextension of the lumbar spine. Exercise should be performed in an appropriate water depth that allows movement to begin in this hip-hinged position. Hip flexion and extension using rubberized resistance. Begin by standing parallel to the pool wall and lifting the foot up towards the surface of the water. Be sure to maintain a nice level and neutral pelvis and all movement coming from the hip. Cue your clients to brace the midsection to maintain nice neutral alignment and stability at the core. This exercise using the rubberized resistance will strengthen the hamstrings and the gluteus maximus in both concentric and eccentric muscle action. This exercise is recommended for persons with low back pain in phase 2 of programming. Be sure to avoid lifting the leg too high into flexion and also moving too far beyond the neutral extension, which may cause hyperextension at the lumbar spine. Knee flexion and extension using rubberized resistance. Begin with the feet shoulder width apart and the knees pointing down on the working leg. The working leg is drawing the heel up towards the gluteals and controlling the movement back down. As the leg flexes and extends, we are working the hamstrings in both directions as we work eccentric and concentric muscle action. This exercise is recommended for individuals looking to strengthen the knee joint or for those following a post-rehab total hip replacement. Hip abduction and adduction using rubberized resistance. Again, begin with the feet shoulder width apart. You may need to use a pool wall for stability and balance. As you keep the toes pointing forward and the hips neutral, lift the leg out to the side. Abduct the leg only to about 35 to 45 degrees range of motion to focus on the hip abductors. We are working using the rubberized resistance, the abductors, both concentrically and eccentrically as you lift and lower the leg in the water. Provide stability at the pelvis by providing abdominal bracing. Keep the knees slightly bent to take any torque off of the moving legs.